Welcome to the Listening Doctor. I'm Dr. Sowmya Josyula, a primary care physician who believes that healing begins not with a prescription, but with listening. Today's episode is called The Lost Skill Why Listening Matters in Clinical Practice. And to begin, I want to share a story. She was a 50 years old, tired, anxious, and holding back her tears. She sat down in my consultation room. She told me quietly, "Doctor, I want to try for another baby." I noticed the hesitation in her voice. It wasn't just uncertainty, it was a fear of being judged. She had already been to several doctors. Each one had some version of the same thing. Why now? Why a third child? You should be grateful for what you already have. Do you know the risk at this age? And so on. And so by the time she came to me, she was armored, ready to defend her choices, ready to be dismissed one more time. As she spoke, I could feel her exhaustion, not just from treatments, but from constantly having to justify herself. She was not asking for permission, she was just asking for understanding. I looked at her and said gently, "I'm not here to judge your choices. I'm not God to decide whether you will or won't have your child. My job is simply to help you understand what's possible and to walk with you through it." She exhaled. Her shoulders dropped. Her eyes actually softened. She was holding back tears. She wasn't just cured, she was hurt. That day, it reminded me that listening isn't a passive act. It's not just waiting for our turn to speak, but it is to listen and understand the meaning. Listening has three levels. First, we listen for the facts, the story of the symptoms. Second, we listen for feelings, what's underneath those words. And finally, we listen for the meaning, what the illness or decision represents in that person's life. With this moment, the story wasn't about fertility, it was about hope, closure, and agency. The sense that she still had control over her own body and her own destiny. When we only hear, we collect data, but when we listen, we connect with a purpose. That connection is what turns treatment into healing. She told me she has been to 4 doctors before. None of them meant harm. They were efficient, clinical, factual, but in their need to solve, they forgot to listen. Each question they asked, "Why now? What's the point?" came from logic and not from empathy. Logic without empathy leaves someone wounded. Every dismissive tone, every look of disbelief added a layer of shame. And shame changes how a patient behaves. It closes their doors. By the time she came to me, she wasn't just trying to conceive a child, she was trying to recover her dignity. Research shows that most doctors interrupt their patient within 18 seconds. 18 seconds? That's all it takes to silence a story. And yet, the truth, the diagnosis, the real concern often comes much after. When patients don't feel heard, they hide their fears. They stop asking questions. They lose faith not just in medicine, but in themselves too. The woman in my story didn't need approval. She needed a doctor who would listen without judging her. Every time we fail to listen, we lose a chance not just to diagnose, but to dignify. Listening isn't soft, it's science. Over 70% of diagnosis just comes from history taking alone. When we listen, we save time, we prevent unnecessary tests, and also we build a therapeutic trust. That day, my consultation followed what I now call the three L's of listening. Lean in, face your patient, set aside the computer, show presence. Listen actively, reflect back what you hear. Listen, it sounds like you've been carrying this alone for a long time. That's a simple sentence. And finally, let silence work. Don't rush to fill every pause. Sometimes silence is the space where truth emerges. In that silence, my patient finally told me about her husband's doubts, her family's disapproval, and her own fear of running out of time. That's when I understood what she really needed. Listening transformed a consultation into a moment of healing. When she left my clinic, her treatment plan hadn't changed much. I ordered a few tests, I made a few referrals, but something else has changed. She walked out lighter. That's the power of listening. It doesn't cure, but it heals. As young doctors, we are trained to identify disease, but the art of listening teaches us to recognize humanity. So here's my challenge for you this week. In your next consultation, let your patient speak for 60 seconds without interruption, just 1 minute. You might be surprised by how much diagnosis and compassion fits inside that 1 minute. I wasn't her savior, I was her witness. And sometimes that's what being a healer truly means. Thank you for joining me on The Listening Doctor. Next time, we'll explore the first 3 minutes, how to make patients feel heard. Until then, take a deep breath and listen.